Hello, my name is Briar, and I will be talking about progressive osseous heteroplasia. Progressive osseosis heteroplasia, or called PO for short, is a disorder which turns skin and muscle tissue to bone. It's typically found at infancy, and the GNAS gene, which was found in 2002, which is also the gene responsible for ossification of bone within inside the skeletal frame. This has been found to be a mutation on that gene, but specifically from the father, and it's also seen to be an autosomal dominant pattern, meaning that you only need one of these genes in order to display progressive osseous heteroplasia. Now, when doctors are trying to diagnose this disorder, they typically look to three things: the ossification in deep tissue, which they can see within X-ray examinations. And they also look to see if the patient has two or fewer AHO features, which Albright's hereditary osteodystrophy is a rare genetic condition with various symptoms ranging from short stature to obesity to rounded face to ossification in subcutaneous fat, etc. They also check to see if the patient has parathyroid hormones, which this hormone is responsible for regulating calcium levels within the body. Now, as far as being a patient trying to understand whether or not you should check to see if your child has this, it's kind of somewhat difficult to tell because there is variability within every single person on the ectopic bone location, where the bone outside of the skeletal frame grows, how fast the bone is ossifying, the joint to fat ossification ratio. If you are just getting fat ossifying in your subcutaneous fat as opposed to your joints, you might not be able to tell. Also, injury suspension. People with progressive osseous heteroplasia, typically when they're wounded, their bodies will react to that wound and ossify that area. And now, as far as medical concerns go, so the ectopic bone typically becomes visible after some months after birth, and this will generally give the child pain, just general discomfort, and even problems moving depending on where the bone ossifies. If it ossifies in the elbows, then your child will have problems moving their arms. If it ossifies in the shoulders, they may have a problem moving their shoulders, etc. As far as the lethality goes, this is a rather new genetic disorder which has been found, so doctors aren't really sure of how it's going to affect the body. They really only know that it ossifies tissue, but they do know that it doesn't affect the organs. They do know it doesn't affect the organs, but they do know it affects the joints and the subcutaneous fat, and they don't know how that affects the organs later on in life. As far as treatment goes, those are typically limited when it comes to patients because surgeries can remove the ectopic bone, but generally those surgeries are typically come with complications, and even if they don't come with complications, that doesn't cure the actual genetic disorder itself. The body will still grow subcutaneous bone. As far as the genetics of this, what you see on the left is the male with the mutated gene because it's typically found on the male, and you will also see that it is a dominant gene. So you only need one of these genes in order to display heteroplasia. So even if one of your dad's genes is mutated, you have a 50% chance. Now, 60 people in the world have this ultra rare condition, including one little girl from Ukraine who is incapable of falling down.
She always needs to be in motion, not sitting around. She can't fall, she can't bump into anything. She can't get injections. Kira is the only one like this in Ukraine. There are 60 people in the world have her condition. She's alone.
Первый перед детками. Как всегда.
Как всегда, да. Потому что ты бежишь первее всех. Кира родилась абсолютно.
Kira was born an absolutely healthy baby, like most people with her condition.
5 месяцев у нее появилась первая.
The first bone appeared around 5 months later, on the inside of her elbow, and then another under her arm. They took 3 small pieces from her elbow for a biopsy, and after 2 months, her right arm had completely ossified. They diagnosed her with progressive osseous heteroplasia. They only found the gene in 2002. There is no cure. It's very difficult to find a treatment for it, because they need to find a blocker that won't prevent the bones she needs from growing to their full size. You have to understand that every bruise takes 10 years off me and her father's life and gives us 100 gray hairs.
100 волос седых. Левая рука длиннее, чем правая.
Her left arm is longer than her right arm. Her right arm won't grow anymore, and 4 of her fingers don't move. She can't hold a spoon or pencil. We signed her up for art classes so she could relearn how to do everything with her left hand.
Чтобы переучить ее.
Я люблю рисовать сердце. А я цветочек. И я.
А чому серце тобі подобається?
Потому что сердце это любовь.
А кого ти любиш?
Люблю, я всех люблю. Я буду сидеть тут. Я танцую и рисую. Я вторник, пятница.
Кушает, рисует, одевается.
She eats, draws, and dresses all by herself. She does it all with her left hand. I really make her do things for herself. When she says, I can't, I tell her, you can, Kira, and you have to. And so she does everything herself.
Веточки, смотри, Кира, сюда смотри. Рисуем веточки, потом веточки.
Варя моя самая подружка, потому что мы с ней А у меня самая любимая подружка Кира. Ты я? Да. Маша, все цвета.
Давай, рисуй. Мне еще тебя переодевать на танцы, Донь. Мы выходим всегда самые последние. В летний период я...
In the summer, I don't dress her any differently. I dress her in t-shirts and dresses with short sleeves. So she isn't shy about her scars, and she won't be shy about herself.
На тоненьких бретельках.
Все, я побежала.
Так, поехали.
Кира — это если Кира что-то сделала.
If Kira does something, she really does it her own way. She's a princess.
Только принцесса.
Вернулись! Раз, два, 3 на левую упали.
Когда вот уже есть же любопытный...
When curious mothers or children ask her what's wrong with her arm, she says, I was born this way, but when I'm healed, I'll run just like you.
На какой улице ты живешь?
На улице Счастливой.
All right. Thank you for learning with me about progressive osseosis heteroplasia, and thank you. Have a good night.